Welcome to our channel. It's a routine case, grade 2 cataract, 62-year-old male. In this, we are demonstrating the steps of direct horizontal chop. The betadine is applied. We use betadine 5%, also comes as epidine also. The fornix are cleared with the betadine to avoid any TARS post-op. As you can see here, the cataract is looking dark. I will show you my microscope OMS 90. We have retroillumination with OmniGlow. So here you can see the change. Putting visco over the cornea for better clarity. Again I will show you. As you can see, the retroillumination gives a very good glow. You can have a easy capsular access, but sometimes it hides the hard cataract also. So you should know at slit lamp what grade you are operating. It's time to enter into the chamber. A 2.8 mm incision is made at posterior limbal site. Now it's time for capsular access. First air bubble is injected. I'm using blue dye to stain the capsule and show you how we did the capsular access. Visco is injected. Complete air bubble should be removed to make the access easy. A small air bubble can create problem during access. I have shown in my previous videos also. Here one thing I will tell you, that as I started the access, my assistant made the capsulotome, and the mistake he did was he made the capsulotome, the rear end little bit inward, the first bent. So the first bend should always be at 90°. As I'm doing the rexes, it's getting little bit difficult to do the rexes, and it's getting smaller because of the inward movement of the first bend. So I'm trying to make the rexes as bigger as possible. I could have changed the capsulotome, or should I opted for the capsular access forceps, but I continued, and now I am pulling the rexes tag slowly to get as much rexes as possible, at least 5 mm, to make the further steps easy. So you should teach your assistant to make a proper capsulotome. If this mistake happens, you can change always. The rexes is completed. We have got almost 5 mm rexes. It's a fully dilated pupil. The last tag is released and the rexes is completed. Now a side port is made 4 clock hours away from the main incision. Should always check the tip of the side port. If there is difficulty inserting, there can be a bend, so you can change it. Now it's time to do a hydro. As you can see, the fluid wave is going to the opposite side. Back decompression is done in between. Multi-quadrant hydro dissection is done. Now hydro delineation. You can see the golden ring in between. Now it's time to put the visco and check the rotation of the nucleus. I always do in all my phaco cases. Here it's little bit hard to rotate. With experience, you know how much force you should apply, and if you feel that your hydro was not good, you can again do the hydro. Never hesitate to repeat it. Here we are getting the nucleus rotation now. Now it's time to put visco and form the chamber. Here I am demonstrating direct chop. For that we have zoomed it. Here we are demonstrating horizontal direct chop. As you can see, first after entering into the eye, we are in Phaco 2. The parameters are vacuum 380, power 60, flow 40. The epinucleus and cortex is eaten up to expose the endonucleus. A small trench is made under Phaco 2 to hold the nucleus from center. Here, as we reach to the center and hold the nucleus, I took my chopper till equator, and from there we are coming towards the center, and laterally we are separating. As you can see the red glow, the separation is complete. We got the two parts of the nucleus. For beginners, you can rotate the nucleus 360-degree and can break the nucleus from opposite side also. With experience, in one go you can break it completely. Now we are emulsifying the nuclear pieces. As you can see, we are holding and chopping. Half D segment is left. It's always good to bring the nucleus in front. It's easy to hold that side. The hole should be proper. You have to calibrate your vacuum as per the grade of the nucleus. As you can see, we are eating the nuclear piece, and below one nuclear piece is acting as a cushion between the posterior capsule and the emulsified piece. The last piece, you should be careful. I have broken it into the two pieces. Again, the cushion effect. You should be slow and steady in the last piece. The nuclear emulsification is complete. Now we have epinucleus and cortex into the back, shifted to Phaco 3. Trying to pull the epinucleus towards the center with lower parameters. Epinucleus is aspirated. Now it's time to do the cortical wash. Some epinucleus is there. With coaxial IA, it's easy to remove the epinucleus also. I have a habit of using coaxial IA and I am comfortable with that. You can use bimanual as per your convenience. As we entered into the eye with the coaxial IA, my vacuum is 400. It is the thicker epinucleus sheet. We are pulling it from the periphery towards the center and then aspirating. Never apply the full vacuum at the periphery. Just apply the vacuum so that you will be able to hold the cortex or epinucleus and bring it toward the center and then press the foot pedal completely. That is the safest place for aspiration of the cortex and epinucleus. You can rotate the tip downwards also, but with caution that you should not hold the posterior capsule. Only few chunks of cortex are left. The last cortical fiber piece. The subincisional one. Be careful here. And the cortical aspiration is completed. Some polishing is done at that site. Now it's time to put the lens. For that, first we are inserting visco into the anterior chamber. Here I am using Hoya Nanex lens having a multi-cert injector. An ozonized lens, very good lens I am using from long time. One haptic is in the back, the other is in the anterior chamber. With the help of the dialer, the haptics are properly placed into the back. Just checking for a piece of cortex there. I have some hesitation for that. Now it's time to do the visco wash. First, the anterior chamber is cleared, the angles are cleared. Now we are going behind the lens, just lifting the edge of the lens and putting the irrigation and aspirating the visco slowly. Visco wash behind the lens is must, and you should learn it with time. It makes the IOP normal next day. In toric lenses, it's very important to avoid any rotation of the lens next day. I'm using Earthly Easy Machine. Now it's time to form the chamber. A small AC wash is done with the hydro. Remove any fibers or cortical pieces. The main wound is hydrated, both sides. Now you will see, as I'm going to hydrate this side port, a small chunk of epinucleus just came into the anterior chamber. In slow motion I'm showing. So sometimes you have epinuclear piece stuck into the side port. So always clear it as I'm doing AC wash, and that piece went away with the fluid. So you can have some stuck epinuclear pieces in the side port. You can get them cleared always. Check this thing always. Side port is done, hydrated, and the case is finished. Thanks for watching. If you have any questions or any suggestions, please give them in the comments.